So in varicella zoster virus, so basically these viruses have are like kind of those same viruses which are the chickenpox viruses. Okay,
Mm-hmm.
did you get the text which I sent yesterday about the
That
pox viruses?
yes.
So if you see the cytoplasm, which has the DNA polymerases and how they make the genetic material inside the cytoplasm.
Mm-hmm.
Okay, yeah, you had a question yesterday about
Mm-hmm.
this.
Mm-hmm.
Okay, so these are like varicella chickenpox viruses, also called human herpes 3. Okay,
Mm-hmm.
so these have pain too. So now I will be like making the differences between the previous like buzzwords which we did with the herpes with the these one.
Okay.
So it causes chickenpox in children and it causes shingles in adults. This is very important. So we have two kind of vaccines. One is a like shingle vaccine which we can give in the adults, and one is the chickenpox vaccine which we give. It's a varicella zoster virus vaccine which we give in the children, and this is a live vaccine.
Okay.
So, and as I told you before, if you cannot give the live vaccines to those who are immunocompromised, including all those which I mentioned, plus
Mm-hmm.
more, or every immunocompromised. Why? Because this live virus can cause disease in those patients, so we have to be careful. So here in children, it's a highly contagious. That is very important. And other than this, this causes almost lifelong immunity. Once you have the chicken pox, so but the again the dormant situation, the dormant stage of the virus in the ganglion can later on uh, uh, awake, or it will be just like during the stressful situation and the other immunocompromised situation. If a kid has the virus and it can dormant in the ganglion, and later on if he's using steroid for like a longer period of time, even I remember my dad got the shingles.
Oh
So
wow.
how happened, like he had a cataract surgery when I was in Pakistan, just
Mm-hmm.
after my medical school, and they gave him 3 days only steroids, only 3 4 days, that's it. And after, I think after 2 3 months, he got the shingles.
Oh
There were
man.
a couple of reasons. Maybe the steroids was not the reason because it was only 3 days. But he had a lot of stress because his surgery was somehow little complicated. So the lens position was not good.
Oh man.
Even I requested one of the best eye surgeons in my hospital over there where I was doing the rotations, but
Mm-hmm.
that was our luck. And I mean, he was able to get only, you can say, 80% of the VN from that lens. So
Mm-hmm.
now he has adopted with that situation because they told us if they wanna reopen, then it could be more dangerous.
Oh wow.
So you guys have to do with this. It is like very rare. I mean, that happened here. Like that surgery is only 15 20 minute surgery.
Mm-hmm.
Take out the nucleus of the lens in cataract surgery and put a new lens.
Mm-hmm.
So I think he got a shingles due to stress, and he called me one day. I was in my Lahore. He called me. I had this rash, and this rash is so burning. It is causing a lot of pain to me. And I asked him, okay, where is the rash? He told me it is very linear and very restricted in this area. I said, restricted? That was one word for me to judge what it is, what it is.
Mm-hmm.
Why? Because this rash is limited to the nerves. It follows the nerves and it stays in the dermatome. That is very important. So it doesn't, if it will involve one dermatome, that will be a whole one dermatome. Okay,
Mm-hmm.
and itching, very important. Burning, very, very important. And pain, these are all the features which are present in these patients. Now the next question is that how the rash look like. Okay, this rash has all phases. Okay, pustules, papules, and vesicles, and all those are present in different stages. If I'm opening couple of pictures for you, can you see here this rash?
Mm-hmm.
So this is not so much scattered. It is just restricted to this dermatomal area.
Mm-hmm.
If you find this rash period, shingles, because all other rashes are scattered, more scattered. So herpes, you will see the vesicles. Here, you can see vesicle, you can see crusts. Even in herpes, we said it's a crust and the scar, but first you have a vesicle, and then those vesicles become crusted and making a scar. Yeah.
Mm-hmm.
So can you see a bigger picture here? Can you see the bigger picture? Yeah,
Yes.
this rash. So it has a vesicle, so everything is in one phase, I mean different phases of the eruption.
Mm-hmm.
This patient is highly contagious because we already discussed here how much time it will be contagious until all this rash become crusted. He will be contagious to transmit a disease. And as we did before in children, maybe there was a table on your uh, PowerPoint. In children, that is a respiratory tract transmission. In adults, it is the contact. Okay, so there is also questions in USMLE. One lady wanna do the do a party and she has a shingles because she's above maybe 60s. Uh, she had a shingle attack. She went to the doctor and asked her, like, what should I do? Should I call because she is going to be host? She say, okay, I had a party and people are coming to my house. Should I cancel it because this is a contagious? So the response for her will be just cover the area and call everybody and attend the party and host them. So if there would be a child, so then you can say just keep him uh, like in isolation until all lesions become crusted. So so they are vesicles, papules, pustules. All those stages are present uh, in this kind of problem. So what is the difference with the herpes in this case? What will be the difference with the herpes in this case
In terms of how it's transmitted, or
in terms of the shape?
they're all varied. There's macules and
Papules
papules.
and pustules and
Yeah.
all things are together. So they are going to erupt in different phases. So
Yeah.
here you can see some other pictures. So this is a shingle rash and blisters. I mean, again, if you see the patches in different areas, so and they are demarcated patches,
Mm-hmm.
not like randomly separate. I mean, they are randomly separate, but the area which they involves, they have a demarcations. Okay, so again you can see this rash. It look like crusted. So can you see this rash?
Mm-hmm.
Yeah. So you can see couple of pictures and get the idea. And then you can see here first disease. Okay, what? So this is the only one page you have. Okay, you got the idea of
Mm-hmm.
the shingles and well, how you treat this disease. Do you want to know that or you don't want to know because it's not on your slide?
Individually, how you treat them?
Yeah, I mean same acyclovir. Give them
Oh, basically.
acyclovir as soon as possible.
Okay.
So why dextroshidyl is why? The reason is that uh, this virus can stay dormant in those areas like in the nerves and it causes chronic pain syndrome. And it is really disturbing for the patients because rash is gone, everything is gone. They just have pain in that area, and skin is perfect now because it has healed. So, but they have a still pain. So, if you don't treat as soon as possible, you have more chances to have that situation in future. So, to avoid that, start the acyclovir as soon as possible. Okay,
Mm-hmm.
and even you can give them vaccine within 96 hours. So if that is an immunocompromised patient, you do not give the vaccine. What you have to give the immunoglobulins. You
Okay.
know that is a passive immunity. Yep. Okay. The six classes of childhood xanthine. What is xanthine?
Rash.
Yep. And like with little fever and all those things. So first disease rubiola. So second disease scarlet fever. Third disease rubella. So fourth one, Phyllotroideus, and fifth is erythema infectiosum, and the sixth one is subitum like roseola. Okay, and these things will come like that. So important third, first very important, third one rubella, fifth one and sixth one. These are very important. The second and fourth I uh, is this the? I think maybe it is the Duke. It look like it has that the other name of that disease. What is that called? Um,
I
sorry,
think the screen is frozen.
my screen is frozen.
It
Okay,
says Dell backup and recovery. Okay, now it's on Google.
it's working. Okay, good. So Duke diseases. There are some like Duke Jones criteria. I just want to make sure what is that disease. So isn't theme okay? Yeah, it is like name of one of the. It is distinguished from measles or other form of rubella, though it is considered as a form of viral rash. So this is not the rheumatic fever stuff like that. This is like kind of one of the rashes. It is though not to be different from scarlet fever. We will see scarlet fever. How much you want to know? Okay. So just remember the other green ones. They are very important. Plus
Mm-hmm.
scarlet fever adds its own important. So in which I will give you some hints. So you need to remember how you can reach that drug. So remember the sixth one. I'm taking it out right now for your convenience because this disease will happen in a different way as compared to others. How? First you have a rash, then I'm sorry, first you have a fever, and then the fever goes away, and after that you start having a rash. For
This
the
is only
others,
for the sixth one?
I'm sorry, for the sixth one, rosy, yeah, roseola. Rosy is different, okay?
Mm-hmm.
So just remember with the rosy if you have a different like rosy. So we have a lot of rosies in Pakistan, like name of the girls.
Oh, really?
Yeah. So they say like Ruby, Rosie, like that. Maybe Ruby, you guys have to. Okay. So and she has a. I mean, first she has a fever, and then fever is away. Fever is out, gone.
Uh-huh.
She has a high grade fever, starting with mom is very worried, and just after that, fever is gone. She's okay. Mom is thinking she's no fine, but just after that, she had a rash, and in that situation, you need to think of that the sixth one. So with
Okay.
the rubella and rubella, we'll show you the pictures also, and we'll give you the idea. First, we need to know how it is transmitted. So through the inhalation of respiratory droplets, most of these viral diseases, site of entry, mucosa of the respiratory, spread within the body via lymphatics and bloodstream. Any confusion in that? Like, uh, if the virus is present in the droplets, what is the droplet transmission?
What do you mean? What is the droplet
Like
transmission?
here is a respiratory droplet, inhalation of respiratory droplet. you explain to me what is this? How it?
Inhalation of a respiratory droplet.
Mm-hmm.
So if someone that's infected sneezes or coughs, then they're
Yeah, even sneezing, coughing are more like powerful. So even talking. Okay,
talking.
so that's why they say stay one arm away from the person who is a tuberculosis patient or respiratory droplets, because they, during talking and during sneezing, coughing, definitely they uh, they spread some of the viruses in the form of droplets which travel through air, and the other person is, if he is much closer, so he can get those. And uh, because our mouth is respiratory mucosa, all inner side of the mouth is a mucous membrane, and
Mm-hmm.
even like trachea and the GI tract, everything is mucus connected to my external environment. So more chances that virus will travel through that and spread out via lymphatics and bloodstream.
Okay.
Secondary, and you have a good idea about lymphatics.
Yeah.
Okay, good. Secondary viremia, infected mononuclear cells transport virus to the skin. So this is the secondary. First you get the infection and later on they can go over there in the mononuclear cells. So just refer to that table again, which you have here. They show where they dormant or where they don't. So mononuclear cells, uh, these are one of the leukocytes in the household. An infected patient, 90% of contacts who have not had the disease will get it,
Hmm.
like those in all those viremia disease. Prodrome is like what happens first
Dr.
before.
Aziz, are you in the PowerPoint or
So can you see the next one?
I'm still on Duke's disease online?
Okay, let me just quickly.
Okay, no.
Yeah. So can I just give you a call so
Yeah.
Skype is not sharing? So in
Okay.
the meanwhile, I just wanna grab my cup of coffee.
Sure.
Okay,
Sure.
thank you. Yeah, let me
Uh-huh.
call you soon.
Okay.
Recorder is on too. So good. So prodrome, the virus in the respiratory mucosa gets attacked over there, and macrophages, different. What is pneumo? Pneumo mean pulmonary side cells, those area. Patient is asymptomatic. Even he don't know he has some prodrome viremia in his body, and starts spreading that lymphatics monocytes. Then about 5 days. So this is like you can say it as a general for different viruses, different periods. They say secondary viremia occurs. The virus spread to the skin, mouth, conjunctiva. Just see the area where why it spreads over there. Skin, mouth has mucosa. Skin, you can say it's also maybe it's a dermatrophic virus. Conjunctiva and respiratory both have the mucosa. Epithelial sites, they are definitely mucosa. So what is different, you know, about endothelial and epithelial? So basically it's epithelial here. Virus leaves the blood vessels and first infect the subepithelial sites, and then epithelial sites, forming papules containing multinucleated cells within the intranuclear cells.
Mm-hmm.
So with these viruses which we did, so your life is now easier, you can say. They have a multinuclear cells. So they have one cell which has lot of nucleus, which I just showed you yesterday. Okay,
Mm-hmm.
but with case of cytomegalovirus, you may have the all eye appearance nucleus. I mean that will be a big nucleus. I will show you. So virus
Yeah,
which
I
is,
need to make a list of everything that has intranuclear
oh, okay,
inclusions,
no
I
worries.
think. Maybe not now, but soon.
Yeah, I will help you in that. Okay. So some have intracytoplasmic inclusions and some have intranuclear inclusions. So we'll help you in making that list if there would be any like that. Okay.
Okay.
So the viruses which have intracytoplasmic, they have like not much those inclusions. Inclusions are just like you can say accumulations of the something in the cell, like intranuclear bodies. So they are just different bodies, look like size of the nucleus.
So
Virus reach while
they're sorry.
I'm sorry.
They're accumulations of what
Like
exactly?
um, I am not sure what is the actually accumulation, but their size look like the nucleus, small bodies, different. I think
Okay.
maybe it is like part of the cells, different. Like it should be part of the cells and which can contain the virus because the virus has attacked the monocytes and lymphocytes and all those
Uh-huh.
different cells. So virus that is an indication. So this cell is attacked by the virus. Virus reaches the surface and is shed to the exterior respiratory tract. 12 to 14 days the initial infection. So 5 days and 12 to 14. So mostly the incubation periods. So this is you can say incubation time before the start of having a sign symptoms. So
Uh-huh.
virus is trying to build his own army over there and then he will have a full blown attack. So take a longer few days for the virus to reach the surface of skin when the characteristics papules rash. You see, it takes him to on the skin later. So first entry is what mucosal layer, mucosal surface. Xanthimatous stage, so it has a rash and fever too. Okay, so fever, the rash is most pronounced on the face, scalp, and trunk, and less on the limbs. This is important for you for these diseases. Please remember that all those 5 6 diseases. So mostly, but here in rubella, it starts from the face. So in females, it's more common rubella. It starts from the face, but in measles, it starts from the back of the ears, like back, like auricular, post auricular part, and then it spreads down from the face down to the trunk. So this is a uh, like most likely way how it will spread from the upper part to the lower part. So here you can see where I was. Yeah, that one. Okay, so less in the limbs. Disease is more severe in older and adults. Lesions progress from the initial macule, papules, vesicle, pustules, cross thin wall vesicle on macular base. So just remember everything. Macules, papules, all those dermatological. But here you need to know, okay, so which has pain, which don't have pain. So we did the mostly when you see vesicles, think of herpes simplex. When you see lot of stages of the crust, macules, papules together, then you think of what shingles,
Mm.
herpes zoster.
Okay.
Okay, so even in the chicken pox, let me show you a picture of chicken pox because it is different. The rash is more spread than in a shingle. So because in the child, can you see here this child? So poor baby. So this rash is chicken pox spread face and the other parts of the body, and it has like kind of you can say crusty vesicular appearance.
Okay.
So, but it can be present in different stages.
So chickenpox is present in different stages, but
It can be
um,
shingles too. I'm sorry. Yeah.
well, which one is all the same stage and which one is different stages?
So both work together. Like shingles and chickenpox basically are of phases of one virus in different ages, but
Mhm.
herpes simplex is different.
Okay.
Herpes simplex will be of only vesicles, and then those vesicles will move towards the crust and the scoring.
So HSV1
And two both.
and 2 are all the same stage.
They stay, like they move from one state to the other, like one by one. Like
But,
vesicles are
but
very
I mean,
important.
the whole rash will be macules and then it'll move to papules.
So in, you mean in the herpes simplex?
Yeah.
So actually they have vesicles mostly, not the other stages.
Okay.
The vesicles then burst out. After they burst out, they make crusts over there. Then you can see.
Okay.
And when they give the crust, it means they are giving lot of tricks in the questions. Usually they give the vesicles in herpes, like
Okay.
bunch of vesicles are over there. But in I mean herpes simplex, I mean to say, in herpes zoster, they will say you give you those all stages, probably like all or some of those vacuoles, papules, pedicles, pustules, like that.
Okay.
And the patient um, is contagious until all lesions become crusted in herpes zoster and the chickenpox stages.
Mm-hmm.
In that, so and in children is a respiratory tract, in chickenpox, and in adults is a contact. Okay, in immunocompromised disseminated varicella, like it means spread out throughout the body in other systems. So basically liver, because it started from the lungs and that area, now it is going to the central nervous system, liver. And uh, this is important, like the shingles as a complication, which I told you, one stays in the nerves and causes chronic pain syndrome. Plus, it has acute complication if you don't treat the patient right away, which is called pneumonia. That is also very dangerous in some time. Okay.
Okay.
So what is this here? Like early stage chickenpox, later stage C. Here on this here, if you follow my mouse, this area, you
Mm-hmm.
have the crust formation. So this
Mm-hmm.
area can kind of more papules, and even these are vesicles. So shingles and chickenpox could be any form. So smallpox throughout the body, more is on the legs. And no, there is no smallpox in the world eradicated.
We
And this,
we were sent an article a month or two ago about there being an outbreak in Syria. I think
again, yeah, that's
of smallpox. Yeah.
in Syria.
Mm-hmm.
So when did you hear that?
Um, maybe a month ago.
Oh, maybe
Yeah.
again, there may be remnants. Like even in
Mm-hmm.
US, they say maybe there's a few of the polios, like very less. But in developing countries, we have a lot of polio still. So yep, anything could be possible. So varicella pneumonia, see, complication. Please remember
Mm-hmm.
that, very important, dangerous. Children, fulminant encephalitis and cerebral ataxia. Why? Because you want to ask some question.
Yeah. Is fulminant? Does that just mean severe
Oh,
or?
fulminant is the you can say very severe
Okay.
and acute. We have a fulminant hepatitis also in some patients. Not here, I mean just a term, fulminant hepatitis. That is very, very dangerous, and it can cause even death of the patient.
Okay.
So acute, severe, uncontrollable thing, you can say fulminant.
Mm-hmm.
Cerebellar, this is not cerebral, it is cerebellar. When you see the word bellar,
Mm-hmm.
it is more related to balance.
Yeah.
Okay, so when you see cerebral, lot of other functions. So it has that cerebellar ataxia, imbalance like gait, congenital varicella syndrome from mother to baby. The mother who has infection of zoster, it is I think 2 days before delivery and 5 days after delivery of the baby. If she get rash, 2 days before and 5 days after. Then we can say the baby is at risk of getting the varicella from her. Okay, so let me just make sure it's a 2 and 5 combination before and after. Yeah. 5 days before, actually it's opposite. Sorry.
That's okay. Five
So
days before,
five
2 days
days
after.
before and 2 days after delivery are at risk of chickenpox shortly after birth. Yep, it's a CDC. Yep, guidelines. 5 days before, yeah, the baby is more close to mother. That is a 5 day period, and when baby is out, then even after that, 2 days after if she develop a rash, it means she was in a prodromal phase, which I just discussed with you, in
Mm-hmm.
the virus had entry into the body. And then so what we give the baby, we don't give the vaccine to that baby right away. Why? Because that vaccine is alive. We give the acyclovir, we treat the patient, we give the acyclovir to the mother also. So infection in utero during the first trimester. So that was when baby is going to have a mother is going to have a delivery. But in then baby can have rash and all those stuff. But in this case here, so it is the transplacental transmission through in the first trimester that could be reason to cause a congenital. Again, think of those things: scarring of the skins of the limbs, damage to the lens, retina, and brain, which we already discussed. Fulminant hepatitis. So damage to the lens, retina, and brain, and microphthalmia. What is microphthalmia?
Small
Small eye, micro, small, ophthalmia, eye. Okay,
eye, small.
good. So shingles caused by the reactivation, which I just told you. One of the complications, one is pneumonia, and the other is reactivation of the virus in the sensory ganglions. Very painful and very troublesome for the patient. Zosters occur in the presence of neutralizing varicella antibody. So uh, we have neutralizing antibodies, and then you can say when the antigen and antibody combine, even they can cause damage. To understand the inflammation is a very simple. If two persons are fighting on a ground, so who will be affected? Like if they are fighting on a grass or in a field, so the stuff on the ground will also be messed up.
Mm-hmm.
Even they are attacking with each other. So this is the same example of antigen and antibody. If they are fighting with each other, so grass will be messed up.
Mm-hmm.
In that scenario, take examples of our body. If antigen and antibodies or inflammatory cells are fighting in my body, in my blood vessels, in my parenchyma, and all those area, extracellular fluid, and then I will get effect of that, the fight of the antigen and antibody. And then you can say I can get rash, fever, all those pillars of inflammation. You can say five
Mm-hmm.
pillars: pain, dolor, color, stuff like that. Okay. The
Mm-hmm.
virus may then be reactivated under stress and with immune suppression. Recurrence replication is accomplished by severe radicular pain in discrete area. I think I already explained this. So pox-like lesions, dermatoma. This is one thing. You can close your eyes over there and pick the answer if shingles are the when they say dermatomal distribution. That is a big buzzword for you.
Okay.
So see here, dermatomal.
Mm-hmm.
This is a common area, and my God, rash here too. Still remember. Yep.
Uh,
So what other areas can involve? The trigeminal nerve, the trigeminal nerve. is like on the facial. Let me show you good pictures of that. That is important. Some Most of the patients come with that trigeminal shingles. If you see here, these like mostly on the facial area, even around the eye. The this lady, see, she has a hair. Okay, can you see it? Okay, this one. So even the yeah, this is very typical characteristics. Patient come with this complaint here around the one eye near like line of the nose and then upper part. So this is like kind of more complicated because it has been crusted already. So they can come with a fresh rash, with a pain, burning. Reactivation can affect eye via trigeminal. See here, you got it. So uveitis, keratitis, conjunctivitis. You already know all those things. What is keratitis?
We talked about this
Yeah,
yesterday.
yesterday. Remember? Yeah. Just the
Um,
survey and quickly. Yeah. You know
yeah,
about that? Cornea.
yeah,
Yeah.
it has to do with the
Whenever
eye.
there is inflammation of cornea, is a
Uh,
keratitis, and
keratitis. Okay.
uveitis is a part of the eye
Uh huh.
which has ciliary body, and those where you know the lens is in the middle, and on the right and left you have a whole bunch of things, and the fibers which are the suspensory ligaments, and where they go in the ciliary body, ciliary muscles, that all area, not the lens, the other right and left, they are called uveal tract area.
Okay.
If you have inflammation over there, it is called uveitis. You can have acute and chronic both. So brain via cranial nerve 7, and so it can cause Bell's palsy and Ramsay-Hunt syndrome. Okay,
Mm-hmm.
let me show you the picture of a person who has, in which the ears are also involved. Okay, in Ramsay-Hunt syndrome.
Oh yeah, that's coming up on a slide.
Okay, the next slide is here. Okay,
That was palsy and then Ramsey hand.
so yep, here you go.
Yeah,
You
that's
got
the
it.
picture.
Just if you need any picture, just you can ask me and I will quickly put here for your quicker
Mm-hmm.
reference. Yeah, even you can open at your own whenever you need. So, and so reactivation can lead to the chronic burning. Same thing. Pain may last well, rash be healed, associated with post-herpetic neuralgia. In so definitely you will be asked these questions. I mean, this is very important. Maybe if your teacher doesn't like the shingles, will not ask, but everybody asks this.
Okay.
Associated with post-herpetic neuralgia is increased sensitivity to touch, hyperesthesia. Okay, so
Mm-hmm.
this is different from trigeminal neuralgia. I mean, kind of same, but this is as a complication here, post-herpetic neuralgia after herpes infection. So, and those who have a trigeminal neuralgia will see that, that is the virus attacking the basically only trigeminal nerve, and in you might not have anything in that patient in the form of rash. Okay, you can see here. So Bell's palsy, when they say Bell's palsy, think of one side and give the your ideas in that. Start from the head, okay? Tell the patient look uh, towards the roof without moving his head,
Mm-hmm.
only with the eyes. So when they do that, they have wrinkles on their forehead normally.
Mm-hmm.
So in this case, no wrinkles, flat surface on that side, okay? And then you tell the patient, okay, I'm gonna close your eyes, I'm gonna keep it closed, so don't let I mean, sorry, tell the patient close your eyes, I'm gonna try to open them, don't let me open. Okay,
Uh-huh.
then you can see the facial paralysis on this area because of facial nerve twitching and weakness, and there will be drooping corner of the mouth, dry mouth, impaired taste. Why taste impaired? Because the I think it's anterior two-third of the tongue is supplied by facial, and posterior two-third is supplied by
Glossopharyngeal.
yes, very good. Glossopharyngeal, nice term. So,
Are you on the Bell's palsy slide? Sorry, I'm still seeing the shingles.
oh, sorry. Okay, yeah, thanks for telling me. Just
Okay,
so now you can see the which PowerPoint. Bell's
Ramsey
palsy.
Hunt.
Okay, I'm sorry. Can you see the Bell's palsy?
Yeah.
Okay, great. Yeah. So maybe when I don't move for 2 3 seconds, Skype sleeps. Anyways, so here you can see again Ramsey Hunt syndrome, very important, in which we give the acyclovir plus we give the steroids to these patients also to decrease the inflammation even quicker. Okay, so vesicular rash on the extensor ear, lower motor neurons, paralysis of the facial, loss of the, lower motor and upper neuron. Any idea of that or not?
Mm-hmm.
Okay, so just have a division in a very simple idea. Have a division in the spinal cord, uh, which leaves the brain, and in the spinal cord mostly upper, which leaves the spinal cord and into different body parts is the lower motor neuron.
Yeah.
So in this case, you have a painful rash, eardrum, ear canal, hearing loss. See, this is a major, like, a lot of complication. You cannot bear with that. So that's why you have to give the steroids to treat him right away.
Mm-hmm.
Vertigo, weakness, difficulty closing one eyes. So and then so it is the facial nerve plus rash. So all those features of the facial nerve, you can add them, difficulty masking plus the ear involvement. Okay,
Mm-hmm.
so paralysis of one side of the face, all those features of the facial. Good. uh, Treat, yeah, what labs you do? Again,
The
Zank
zinc
smear with
sphere.
scraping base of the vesicles, and immunofluorescence staining of the scraping, detect of the, can you just write down somewhere? Remind me to provide you with the with those list of the intranuclear intracytoplasmic inclusion. Please write down somewhere and remind me, okay?
Okay.
So immunofluorescence staining of the scrapings, detection of the viral DNA in the vesicular fluid. So because this is a DNA virus, treat with all those acyclovir. So you know wafers. I just remember sometime with a wafer, VAF. Okay, like VAF. All
Uh-huh.
three drugs will come here. So, but A is in the middle. So A is important because
Okay.
it is in the middle.
Does first Carnet have a different mechanism of action, or is it all the same?
So these all, I think they are same mechanism we did yesterday. You
Yeah,
remember?
with the thymidine
So the
kinase.
thymidine kinase. So because they are one class but different. Uh, Different, you can say, agents. So I'm not sure about Foscarnet. I can see for you.
That's okay.
So sometime when you will be at this stage, so you will have a lot of ideas, but things will be like skipping from your mind getting older.
Yeah, things are like that now for me.
Oh, so don't worry. So just like be confident.
Mm.
Immunoprophylaxis. So like passive immunoprophylaxis and active. So you already have the idea. I think you answered my question on those that day when I asked you different scenarios: artificial, active, naturally active, artificial passive, naturally passive.
Uh,
So I don't need to go in detail for that. Just remember we give the passive in the form of immunoglobulins and active
mhm.
in the form of vaccines. So please don't forget what to give, whether is this a killed or uh, alive. So on your Kaplan book, there is a very good formula if they still have. So in microbiology, virology, so that is like rip, it is called Mr. VZ Mapsy, like that, Mr. VZ Mapsy, and the
Yeah.
other formula is a Mr. VZ Mapsy, so they are alive. Okay. The other one is RIPA, like you can say RIPA, rest in peace always. It should be in the initial maybe few pages of the start of the virology. Can you see it? Or I can open here if you.
Like it's not in the herpes section, it's at the start.
It should be at start. Yep, in the virology. So, so you got it.
No. What is it? What is it called? What
Uh,
am I?
it's like vaccinations, virus vaccinations.
I mean, vaccines.
So, like, just tell me what is the page virology starts, please.
This is a newer book, so medically important
Maybe it's
viruses
different.
for me
Uh,
starts
uh, I'm sorry, your immunology is first or microbiology is first?
immunology is first.
Immunology is first, so mine is micro first. So, okay, let me.
I'm looking at vaccines in the back.
Okay, I think I need to open the philosophy and then we'll show you. Coming up.
Active immunization killed vaccines.
Mm-hmm. Yep.
Rest in peace.
Oh yeah, you got it.
Always.
Yeah, that formula. So remember that formula of different viruses, vaccines. Okay.
Oh yeah. Okay. Let me write this down.
So you will see who is alive and who is dead, and
Uh-huh.
then keeping in mind that thing. So don't give live in immunocompromised. Okay. Let's start. The
Uh-huh.
Epstein-Barr virus is human herpes 4. It is monos. So usually it has associations. That is very important for you to remember. Two different cancers: Burkitt lymphoma in Africa, nasal pharyngeal carcinoma in Orient, and then the infectious monos in the West. Like this is not cancer, actually infectious monos. The other Burkitt's lymphoma is a cancer, nasopharyngeal carcinoma. So also causes hairy oral leukemia. So I mean leukoplakia. Hairy oral leukoplakia is a kind of, you can say you have a mouth thrush, and that has membrane stuff like that. So Hodgkin disease. You know difference between leukemia and lymphoma. So here is actually no leukemia but lymphoma. What is lymphoma?
Infection of or a problem with the lymphocytes.
Yep, it's the lymph nodes basically.
Lymph nodes.
When
Okay.
they become enlarged, okay,
Mm.
and also when they become enlarged plus hard and rubbery, that is very important. If you have a painful lymph nodes, you do not need to be worried much. But if you have a painless rubbery lymph node, you must be worried. Why? Painless rubbery and bigger. normal size is around, I think, 1 centimeter. It's more than that. So you able to feel them. So then you ask the patient, when I touch, does it hurt or is hurting without touching even? So
Mm-hmm.
that means he might have some infection, some xanthine going on, some virus attack, and then he might be okay later on. But the patient who has hard and rubbery lymph nodes, and when you ask, since how long you have, I don't know, maybe 2 years, maybe just like few months, but you feel them, take the biopsy right away. In
Okay.
case of the pain, don't take the biopsy, just wait, okay? So immortality is B cell in the tissue. So Epstein-Barr virus has um, is like tendency to spread from the saliva.
Mm-hmm.
Again, keep in mind that latent part of the infections, so virus persistence, restricted virus expression, potential for reactivation, and lytic replication. Same, we already discussed life cycles of different viruses. They have lytic phases, they can have lysogenic phases. So it is like it stays over there in lysogenic and then reactivate to become lytic. Two major strains, A and B, latent phase antigens, so which is called Epstein-Barr virus nuclear antigens, and LMP, latent membrane proteins. So what they are? So one, the upper one is eBNA, is viral DNA episome, so part of the DNA. The LMP1 is mimics activated growth factor. It it when it mimics the activate, it means it act like activating the growth factors. More growth of this virus will happen. So and it moves towards the early antigens phase and then late antigens.
Uh,
Non-structural proteins whose, I'm sorry.
sorry, it's on the previous slide. So
So now
EPN.
you able to see it.
Yes.
So okay. So then structure the late antigens.
What is
It
the episome?
episome is a part of the you can say part of the nucleus.
Okay.
So let me show you the pictures here. It's one area, so plasmids. I think maybe they say that the other name of the plasmid look like. So it just is a part of the nucleus or the nuclear area. Okay.
Okay.
So you wanna know the exact definition of it?
No, no, that's okay.
Okay.
I just didn't know the word.
So, and then the non-structural protein whose synthesis is not dependent on the viral DNA replication.
Uh-huh.
So, it indicates onset of the productive viral replication. Like it means in this stage it start replicating, and then the structural component of the viral cascade, antigens, viral enveloped glycoprotein. See, first non-structural try to cause the virus to become replicate, and that is not dependent on the DNA replication. The late antigen phasic will be replication of the structural component. So this is the like stage in which the virus antigenic phases happen, and they tell the body we are here, and then body has to do something for them to make antibodies. Uh, through saliva, kissing disease very common, initiates infection of the oropharyngeal epithelial cells, spreads to the infiltrating. Please remember that maybe he will ask you this where it goes. Very because it's a very important disease here in US. So maybe you will have questions. So which cells? Tissue tropism. It stays in the tissue, and B cells are the hit target, defined by the VAP binding to the CR2-1 receptor. Again, how they enter into those cells through their CR1 and CR2 receptors for CD, C3D. This receptor expressed on the B cells of the human, We already discussed CD21 and CD19, okay?
Uh-huh.
So,
Those are both B cell markers.
I'm sorry?
Those are both B cell markers, CD19, CD21.
A same thing, CR2 or CD21, they are same thing,
Okay.
different names. So they are markers of the B cells, you can see. CD90 is also present on the B cells. So, and they attack with those viral proteins, and virus gets entry. So even the other epithelial cells of the oropharynx and the nasopharynx. See again that mucosal area surface. So infection has three outcomes: replicate, latent, and stimulate and immortalize B cells. They have to lyse the B cells to come out, to cause the viremia and then cause the having those sign symptoms. This disease have one different etiology, I mean one different symptomatology, which is called the pain on the left side of the belly. Why? Because they can cause the enlargement of the spleen. B cells are hoarding the spleen. B cells are also present in the spleen and even T cells because they grow over there. They become mature even more after coming into the blood. So, and this virus keeps them busy, making the spleen bigger. We tell these patients do not have a contact sports until 2 3, like at least 3 4 weeks, because they have a risk of rupture
Okay.
of the spleen. So
Which slide are you on?
I am 54, is still not moving.
No, it's back on 52.
Okay, so give me 1 second so that sometime maybe it's due to the heavy load on my computer because difference in
Yeah.
Skype recorder and all those. So just and sharing. So let me know. I think I need to talk to Skype maybe. So what? Because it doesn't happen before. I don't know why. So
Is
this
it
maybe
possible that
this.
it's my computer?
Uh, I mean, doesn't look like because maybe some signal stuff I can say.
Uh-huh.
So not the computer. Whatever we are like connected, we are processing the information, and then it's a signals how quickly uh, they transport the stuff towards your screen. So and I got this complaint maybe about 1 or 2 weeks before with my, so maybe one
Okay.
other students and not the others are like in,
Bless
sorry.
you. Bless you.
Thank you. Sorry for that.
That's okay.
Um, so semi-permissive replica, can you see it or not?
No, it's still
Okay,
on.
no problem. Let me uh, try it again.
So
Try again.
I didn't know that. So with EBV, you can see